Glow ASMR Lab.
Observe the surface closely. Beneath these pores, layers of hardened sebum have built up over time. This is not just skin. This is a controlled transformation about to begin. Steady pressure begins now. Watch carefully as the first blockage starts to break. That subtle pop you hear is the moment resistance gives way to release under precision. Multiple areas, multiple extractions. Each controlled release creates a satisfying response. Your mind recognizes this pattern as relief, structured and clinical. Patient 1, Day 1. The skin appears dull, with visible oxidation across the pores. This baseline shows the extent of surface-level congestion clearly. The 24K gold mask is applied slowly and evenly. Its role is to soften lipid bonds and prepare the pores for a smoother and safer extraction process. Observe closely as the gold mask settles deep into the pores. This phase allows the hardened sebum to loosen gradually without damaging the skin. Day 10. The mask is removed. Early improvements are visible now. Surface congestion begins to dissolve, revealing a slightly clearer texture. Day 15. Extraction begins gently. Notice how the oil releases with less resistance compared to earlier stages, indicating internal softening. Day 20. The skin reflects more light now. Pores appear reduced, and the overall texture shows visible refinement and clarity. Day 30. Final reveal. The skin appears smooth, reflective, and glass-like. This is the result of consistent, controlled treatment over time. Patient 2 begins with heavy oxidation. Darkened pores indicate prolonged buildup of oil and environmental exposure over an extended period. A concentrated gold serum is introduced carefully. It penetrates deep into the pores, targeting congestion zones beneath the visible surface. Absorption phase begins. The serum integrates with the sebum, weakening its structure gradually and preparing it for easier extraction. Day 12 extraction. Notice the smoother release now. Reduced resistance confirms that the internal blockage is breaking down effectively. Day 18. The pores appear clearer. Remaining congestion is minimal and easier to manage compared to earlier formations. Day 25. Skin tightening begins. The pore walls contract naturally as the internal debris is removed and balance is restored. Day 30. Final clarity achieved. The skin now looks refined, clean, and evenly toned with a natural luminous finish. Patient 3 presents deep-rooted congestion. These pores require precise pressure and careful handling due to the density of blockage inside. Pressure increases gradually. The skin stretches under controlled force, preparing the hardened sebum for release without damaging the skin. Extraction begins. Thick sebum emerges slowly, confirming long-term accumulation beneath the surface layers of the skin. A second release follows. The deeper pop indicates multiple layers of blockage being cleared from within the same pore. Observe the length of the oil strand. This clearly shows how deep the congestion extended beneath the visible surface. Relief phase begins. Internal pressure is reduced, and the pore starts to relax after the heavy extraction process. Cleaning stage follows immediately. Remaining residue is carefully removed to prevent future buildup in the same area. Post-extraction, the pore now appears clearer, less inflamed, and significantly reduced in size compared to before. Dense congestion across the cheek area is visible. Multiple pores are affected, requiring steady and evenly distributed pressure. Controlled pressure is applied carefully across the surface. Each movement is calculated to target specific clogged pores. Sequential releases begin. Each pop represents a different pore clearing under sustained and controlled force. Extreme macro detail reveals oil exiting the pores. The intensity indicates long-term accumulation. Skin begins to relax gradually after repeated extractions. Tension reduces visibly across the treated area. Cleaning ensures no residue remains. This step is essential for maintaining long-term clarity. Pores begin tightening naturally. The skin adjusts as internal pressure is removed. Final texture appears smoother and more refined compared to the initial state. The chin area shows stubborn congestion. These blockages resist light pressure and require deeper controlled force. Pressure increases carefully. The skin stretches slightly as the blockage prepares for release without damaging. A heavy release occurs. This confirms the presence of a dense and fully compacted blockage. Multiple strands follow the initial extraction, showing layered buildup inside the pore. Slow motion highlights the elasticity and thickness of the extracted sebum. Cleaning phase removes remaining oil completely from the area. The skin begins recovery. Redness reduces gradually as the pore stabilizes. Clearer pores and smoother texture are now visible after the full extraction. Clustered blackheads indicate advanced congestion levels requiring focused extraction. Pressure is applied precisely to isolate the largest blockage. A large root is extracted, confirming deep pore congestion. The pore empties fully, releasing all internal buildup. Close-up shows a clean internal pore structure. Serum is applied to calm and protect the treated area. Inflammation reduces as the skin stabilizes. Pores begin shrinking naturally after clearing. Smooth, healthy glow returns to the skin. This final case shows extreme resistance with dense, compact buildup. Maximum precision pressure is applied carefully. A major release clears the deepest blockage. Macro view highlights complete extraction. Cleaning removes all remaining residue. Skin stabilizes after treatment. Final glow achieved with fully cleared pores. 7 patients, 7 transformations. Each journey demonstrates the power of controlled and consistent treatment. Compare the results carefully. Which case delivered the most satisfying transformation for you? Final result achieved: smooth, clear, and glowing skin through precision and discipline.
Glow ASMR Lab.